Hi, I'm Dr. Walter Matwichuk, and the purpose of today's intermittent reinforcement email message is to talk a little bit about the difference between being in therapy and having the mindset that allows you to profit from therapy. I've often been struck by people who have said things like, I think everybody needs to be in therapy. When I hear that statement, I often wonder what they really mean. It seems to me that what they suggest is that therapy is a process of self-reflection, which I'm completely for, but it seems to be an ongoing process that never ends. My problem is that when people come to therapy, I think it's better if they have a different mindset. I think it's important for them to be in therapy and see that it's an educational process aimed at achieving certain goals. If these goals are well specified, then progress will result. If the therapy is a good one, meaning the theory is a useful one, and they work at it. It's that last variable that is of utmost importance and the topic of today's intermittent reinforcement email message. Being in therapy and talking is really not enough to produce emotional and behavioral change. The person in therapy has to change their mindset to see that therapy is a process of education. And in order to learn the skills and ideas of REBT, one has to devote time to it, both in the sessions and outside of the sessions. This is the aim of REBT, to get you sufficiently informed of useful ideas, a good theory of emotion, and strategies for changing target behaviors, and then to set you free so that you can do self-therapy the rest of your life. There's nothing wrong with coming back to therapy when you may be facing a new problem and having difficulty reactivating or applying the learning that you derived earlier in your life to the new problem. But I really don't want to see people be in therapy not actively working at learning, growing, and changing and moving towards goals. REBT will help you develop insight, but it's not the insight that you may expect. It's an insight into how your emotions work, an insight into how you are largely responsible for creating your emotional upset, insight into how to go about changing your emotions and behaviors, and insight into what it takes to maintain progress and extend it to new areas. So as you can see, my preference is to help patients move towards a mindset that accepts the active role they will play in the therapeutic process. So I'd suggest that you carefully read today's intermittent reinforcement email message and go over some of the rigid and extreme attitudes that undermine having that mindset. Thoughts like, it's talk therapy, so all I have to do is talk, is one of those ideas. Others include attitudes like, well, I've been this way all my life, and there's no guarantee therapy's going to work, so why should I work at it? Or, it's too hard to work steadily at my therapeutic skills and ideas. Go over these ideas and look at the functional attitudes that I suggest you replace them with. And circle a few and rehearse them each day so that you too reinforce the idea that these healthy attitudes are going to help you actively work at your self-therapy. I would also like to remind you that on Saturdays I do a demonstration of these REBT ideas and skills and strategies. I hold a conversation with a volunteer who's willing to discuss a real problem. At the end of 40 minutes, I then accept questions from the viewing audience. It's free to attend, and you may write to me at rebtdoctor, D-O-C-T-O-R, @gmail.com to get your Zoom invitation. It's at 9 a.m. Eastern, that's 2 p.m. in the UK, 4 p.m. in Moscow, 6:30 in New Delhi, 10 in Tokyo, and 11 in Sydney. I hope you can attend this weekly event. I think you will profit from it, because if you're interested in learning REBT, watching other people struggle with these ideas will help you to, one, better understand them, and two, use them in your own life. I hope to see you on Saturday.